Michael, thank you for joining us, Capital and Power. I'm curious, what does Ispire do? How would I interact with Ispire in the United States?
Yes, Ispire is essentially a technology company at its core. We historically has been the leader in introducing new vaporization technologies to the industry, whether it's cannabis vaping or nicotine vaping. And more recently, we got into what we call age verification or age gating technology as well, combining the point of use age gating with our vaping technology, vaping devices. We are able to support the consumers and, of course, regulators in terms of protecting consumers, adults and youth alike.
Okay, would I be buying Ispire manufactured e-cigarette to vape, or am I only going to encounter you with the technology?
A good question. Within the United States, of course, on the nicotine side, we all know there is FDA's PMTA requirement, which is a very lengthy approval and review process by the FDA. So currently, within the United States, we don't have our own branded e-cigarette for sale. And outside of the United States, we do have our own branded e-cigarette, especially in Europe. So within the US, we really want to become a technology solution provider rather than a branded play here. But our technology has very broad application. Simply put, Adam, if I have to go beyond the vaping industry, our technology could be used in many different areas. For example, handgun. We could put that technology on handgun to control who is allowed to use that gun. Only the verified user or owner would be allowed to use that gun. And that's just one example. The other example is pharmaceutical applications. As we all know, there have been a large number of, let's call it accidental use by kids, by people who are not supposed to use certain pharmaceutical drugs, and they get their hands on it, they accidentally use it, and of course, that's undesirable to anybody. We could use such age-gating technology on devices that delivers pharmaceutical drugs.
Let me get back to vaping, though. Age gate device. Does this mean that in order for the vape device to work, some kind of thumbprint or face recognition would have to take place before the individual could insert into their mouth to vape? Am I accurate?
Oh, you are spot on. Yes.
And you have this technology now.
That's what we are introducing now.
Wow.
Yeah. Historically, to prevent youth from drinking or using tobacco products, we count on retailers to verify the user's age. But we all know that's not foolproof, right? That's why kids still use alcohol, use tobacco, because they can count on adults to get the products for them.
That's how we did it when I was a teenager. We would, usually give somebody who needed some money, here's some money, go buy us a six-pack of beer. How do you get around that with the technology you're using? Because if there's an 18-year-old who can legally vape, how do you prevent them from passing the device to a 14-year-old?
Great insight there. That's exactly what our solution is to solve. Solve that user, the actual user of that device challenge. So You could be, let's say, old enough to buy the device. You could use it, but if you pass down to another user, that user will have to go through a very quick verification again. So you can't just activate it and hand it to another person.
You're taking the fun out of being a teenager. I probably shouldn't say that because it's many years since I was a teenager. So you're introducing this technology. Is anyone actually currently deploying it?
Not yet. So how this came about, Adam, was for the last 2 years, we have been trying to come up with a technology that will protect kids from using e-cigarette. Right, as we all know, in the U.S. and worldwide, underage use of e-cigarette has been a number one, let's call it number one concern among parents and regulators. And currently, there is not a reliable solution. So we came up with a solution that is blockchain-based. There is a small, tiny chip that's blockchain-based chip that's embedded in the devices. And the chip has Bluetooth capability built in, and the device would communicate with an app on the smartphone. And as a user, before you are able to use the device for the first time, you have to go through about 1 minute initial verification process. So you need to, the app will scan your government issued ID, whether it's a driver's license or passport. And we would send the information to our so-called identification verification vendors, such as Clear. We all, in the United States, we all know Clear. Clear is a government trusted, certified verification service provider. We pass the information to them, they process it. And then we would require the user to have a quick face selfie or face shot from the smartphone. And then in the back end, Clear, for example, would compare the ID information with the facial image, biometric image. They will, once it's done, they send us a token. They don't send us detailed information. They send us a token. The token is very simple. It would require frequent verification. Of course, we are working with regulators worldwide right now. Within the United States, we have been working with FDA for the last year in getting this solution approved and then licensed to all players in the world. So to answer your question, it's really a matter of how frequent the age verification process need to take place. In some situations, regulators in some countries would say, you know, as long as you use the device within the 10-minute, 15-minute time of your verification, you can use it. You can reuse it, but after a certain time period, you need to re-verify. And in some countries, they are saying, as long as the device stays within the range of the Bluetooth connection, you don't need to re-verify because you own the phone, right? And you own the device. This getting approval for this technology will be a very important milestone for the company. So far, we haven't received any approval yet, but concurrently, Adam, we have been engaged in not only with the FDA in the US, we have been working with regulators in the UK, Malaysia, and some other countries on a worldwide basis. Incidentally, some countries embrace this technology much faster than the FDA. We all know FDA has a lengthy review and approval process. As far as approval, Adam, we on one hand, we submitted our own solution for approval. Once approved, we can share the solution or license the solution to other people. So within the US, we have started working with the FDA about a year ago. And following FDA's guidance, early this year, we carried out a so-called clinical trial between January and April. It was a very successful clinical trial. Success rate was 100% based on the randomly selected users or vaping users. And they were able to go through the process without any instruction to verify their identity and age. And as a result of that, we submitted a so-called solution PMTA, not a product PMTA, but a technology solution PMTA in late May. And FDA is reviewing that solution right now. We certainly are hoping for early 2026. On the other hand, Adam, in late October, there was a Food and Drug Law Institute conference held in Washington, D.C., and the keynote speaker was Brett Kaplow, who is acting director of Center for Tobacco Products. In his opening remark, he mentioned the only way to unlock flavored e-cigarette in the United States to adults is through point-of-use age-gating technology. Of course, we didn't collaborate with him on that topic, but he made that speech. As a result of that speech, we received an overwhelming number of inbound inquiries from, you can imagine, all players, big tobacco players, medium-sized, small. Everybody wants access to the technology. And we have been busy, you can imagine, since then. So there is a probability, Adam, that such players, a big tobacco player, could use this solution to amend their existing PMTA applications and accelerate the approval by the FDA for their flavored PMTA applications. So the reason I bring this up, Adam, is because if they do go that route, there is a likelihood their products would get approved rather fast by the FDA.